Last night, the first open enrollment period under this law came to an end. And despite several lost weeks out of the gate because of problems with the website, 7.1 million Americans have now signed up for private insurance plans through these marketplaces. Now, that doesn't mean that all the problems in healthcare have been solved forever. Premiums are still rising for families who have insurance, whether you get it through your employer or you buy it on your own. That's been true every year for decades. But so far, those premiums have risen more slowly since the Affordable Care Act passed than at any time in the past 50 years. It's also true that despite this law, millions of Americans remain uncovered, in part because governors in some states, for political reasons, have deliberately refused to expand coverage under this law. But we're going to work on them, and we'll work to get more Americans covered with each passing year. And while it remains true that you'll still have to change your coverage if you graduate from college or turn 26 years old or move or switch jobs or have a child, just like you did before the Affordable Care Act was passed, you can now go to healthcare.gov and use it year-round to enroll when circumstances in your life change. So no, the Affordable Care Act hasn't completely fixed our long-broken healthcare system. But this law has made our healthcare system a lot better. Every major piece of legislation, from Social Security to Medicare, the law is not perfect. We've had to make adjustments along the way, and the implementation, especially with the website, has had its share of problems. We know something about that. And yes, at times this reform has been contentious and confusing. And obviously it's had its share of critics. That's part of what change looks like in a democracy. Change is hard. Fixing what's broken is hard. Overcoming skepticism and fear of something new is hard. A lot of times folks would prefer the devil they know to the devil they don't. But this law is doing what it's supposed to do. It's working. It's helping people from coast to coast. All of which makes the lengths to which critics have gone to scare people or undermine the law or try to repeal the law without offering any plausible alternatives so hard to understand. I got to admit, I don't get it. Why are folks working so hard for people not to have health insurance? Why are they so mad about the idea of folks having health insurance? Many of the tall tales that have been told about this law have been debunked. There are still no death panels. Armageddon has not arrived. Instead, this law is helping millions of Americans. And in the coming years, it will help millions more. I've said before, I will always work with anyone who's willing to make this law work even better. But the debate over repealing this law is over. The Affordable Care Act is here to stay.